My name's James Donnelly. I'm the owner and operator of Safehaven Insurance Agency. We specialize in Medicare planning for seniors and anybody who's eligible to go on Medicare. So if you're on disability for more than 24 months, permanent disability for more than 24 months, it opens up an election period where you can enroll in Medicare. So we don't just work with seniors 65 plus. How I got into the business, I was a young father, and I met with an insurance agent, and I took out a whole life policy and a term policy for myself, for my children. And what happened was I realized that the whole life policy was interesting because as a young father and business owner, I was able to put extra funds in the whole life policy, and they would accumulate dividends and interest every year. And I thought it was a great tool. So I had a lot of friends that were in business, and I told them about it, and I kept on referring them to my insurance agent at the time. So continuing working in my family's business and my own business, I grew frustrated. I grew frustrated with a lot of the regulations, a lot of employment retention and hiring issues. And one day I was sitting at my desk, it was about 9 p.m., and I opened up a letter from my insurance agent. It was a thank you. And he said, "Thank you, James. I just want to let you know, within the last couple of years, you've referred me 35 clients. And I appreciate it. If you ever thought of a change of careers, reach out to me." And I actually picked up the phone and I reached out to him, and I said, "Lance," I said, "talk to me about this change of careers. It's 9:30 at night. I'm still at my desk. I'm going through my mail. I'm trying to figure out plans for the next 60 days, and I'm a little frustrated." So he said, "Come in and talk with me." So I came in and talked with him, and I ended up not working with him. I ended up getting licensed and contracted with Northwestern Mutual. I sold my companies, and I was happy. I had a cushion. I was able to help people like this gentleman helped me. Through me working with Northwestern Mutual, they wanted me to call my friends and my family. And I was so uncomfortable with that. Not because I didn't see a value in what I did. I just didn't want to be that annoying person that called you. And I didn't want my Aunt Rachel not to answer the phone because I was calling her to sell her insurance. I wanted her to answer the phone because we were gonna, just shoot the shit, So I kind of veered away from that, and I reached out to new business owners. But then what I realized was quickly that if they didn't qualify for a plan with Northwestern Mutual, there was nothing I could do for them. So after time and time again running into this situation where people weren't eligible for a plan because they had a heart attack or they had cancer or they smoked and they couldn't afford the rate, I decided to leave Northwestern Mutual, and I went independent, and I contracted with as many companies that I could. So I was able to help anybody if they had a heart attack, if they had cancer, if they smoked, even if they had a drug history problem. And I was flourishing. My business was flourishing. I was loving what I did. I was helping people secure their family's future. And one day I remember I went to my grandmother's house, and we had Chinese food, and my cousin's a pastor, and we watched we did a Bible study online virtually. And I was so happy I got to spend this time with my grandmother, and I was so proud of my cousin for being such a successful pastor and speaking so well. The next day I got a phone call that my grandmother fell after I left, and she broke her hip and she had to have surgery. So I went to the hospital. I was there. She was doing great. They moved her to a rehab center after 7 days of being in the hospital. So I'm at work, and all of a sudden my aunt calls me, and she said, "James, they want to switch Grandma's Medicare plan, and I don't know anything about it. You're the insurance guy." And I said, "I don't know anything about Medicare. I know seniors go on it for medical coverage when they're hit 65. So I researched it. I found a friend that specializes in Medicare. He was in the Midwest, Dallas. He's an amazing guy. knows Medicare in and out. And he kind of walked me through it. And they had no business switching my grandmother's plan. She was in a Plan F, which is no longer available. You have to be grandfathered into it. They put her in a Plan N. And we didn't know why, and we were trying to figure it out. It didn't make sense. So turns out the rehab center worked with a Medicare agent, I guess a friend, and if he switches their plan, he makes a commission. So it kind of worked for everybody, except for my grandmother. So I decided from that moment on that I was going to dig into Medicare, figure out everything about it, and teach all of my clients about it. Because I wanted them to have a resource to go to have questions answered. Because if you Google something, it's so ambiguous and gray, and it's not solid information. There's so many different websites that pay for their answers to be on top. It's ridiculous. So I dove into it for a year. I got all my certifications, and I started working with all of my clients. And within 6 months, I realized, like, wow, I touched my circle. Now what? So I decided to go out and do Medicare 101 seminars. And I sent mailers out to anybody turning 65. And I do these seminars monthly. I do 3 a month, Medicare 101. It's not a sales seminar. It's educational. Because I want people to know what the requirements are, what their options are. And most people who are still working over 65 and have group coverage do not need to enroll in Medicare. So I started doing that and helping people. And then I said, you know what? Let me just focus on Medicare. I want to be the Medicare guru. I want to be the guy that people know. Oh, Medicare, let's call James Donnelly. And that's why I do what I do. And every day is a constant reminder of why I do what I do. I have stories that would blow your mind. People that think they have to enroll in Medicare, people who have great Medicare coverage from a retired state job, a retired union job, police officers that are so confused by the inundation of mail and phone calls that they think they have to go on another plan. I met with a gentleman the other day. He came to one of my seminars in November. His birthday was in May. He came into my office. He had 2 giant shopping bags full of literature and mail and a box. The box was medication, because I told him, bring me a list of his medication, and he just brought me the box of medicine. And he sat down, he dumped the paperwork on the conference room table, and I said, this is everything I've gotten, he said, in the mail. I don't know, should I go with United Healthcare, Humana, Aetna, Health First? I don't know what to do, James. And I said, well, let's back up a little bit. What's your story? How do you have health coverage now? He says, I'm a retired teacher. I'm collecting Social Security and I have a pension. I'm already enrolled in A and B for May because I'm on Social Security. They enrolled me automatically. I said, okay. So talk to me about these benefits that you get from your retirement. He says, I have medical for life. So here's an educated professor. He told me he worked for NASA. He went to Egypt and excavated some of the tombs. He was just such an amazing, intelligent person. And he was confused by all this literature that was being mailed to him and all of the phone calls. I said, sir, you just answered your question. You have medical for life. So your medical from your retirement from being a New York City school teacher is your supplement. That is your drug plan. You have the best of the best. Throw all of that literature in the garbage. Don't answer the phone. You are set. And if anyone ever calls you to speak to you about Medicare or switching your plan, hang up on them. It is meant to confuse seniors. All of this literature, all the phone calls, it's meant to instill fear, where you make an impulsive decision as to not miss out on, the shiny object they're waving in your face. Call somebody like me, a trusted Medicare advisor that could walk you through the process. You don't have to enroll in anything. I don't care if you do. If you are good where you are, if you're a retired police officer, firefighter, teacher, union member, you are set. And that makes me happy. That actually fills me with joy that you are taken care of and you don't ever have to worry about Medicare. That's a little bit about why I do what I do. Every day is, like I said, a reminder of why I do what I do. These little stories. I met with a woman a couple weeks back. She called me from an ad that I had online, questions about Medicare, call James. She called me. She said, hey, James, I want to meet with you. I'm not sure about what plan I'm on. I don't know what's going on. She was in the Bronx, New York. I drove to go see her. Sweet woman. I met her husband. They were in their late 80s. He was a retired Navy vet. She was a retired school teacher. Again, great benefits. He was set for life with his VA benefits. She was great, but she wasn't a full-time teacher, so she didn't get benefits for life. She said, I think I'm on WellCare. I'm not sure. So I called my WellCare rep, and my WellCare rep said, James, she was in WellCare. She's in United Healthcare. She was in Humana. She keeps on switching. So again, I said to her, stop answering your phone. Stop speaking to people about Medicare. We found the right plan for her. She filled out, she was actually in a great plan for her. We changed the change of broker form. I went to my office to file it. The next day, my rep called me and she said, James, she's not in WellCare. She's now in United Healthcare. So when I called to speak to her, her husband said that she had fallen and she was in the hospital. And he was trying to get in touch with their daughter to find out, to let her know where mom was. So I remember they mentioned their daughter's name. I remember that they said she was traveling in Paris with her daughters. But I remember them saying where she worked. So I Googled it. I got her number. I was able to get in contact with her. She wasn't traveling. She wasn't in France. She was at work. Her parents both have dementia. And the mother answers the phone, and she was on the mother's smart enough to go on Facebook and click on ads. And she kept on giving out her Medicare number, and that's why people kept on trying to switch her. It's a sad story. But you need to tell your loved ones not to answer the phone, not to give out their Medicare number. Again, to sit down with somebody that they trust and have a relationship with that they know will do the right thing. There's so many stories that I could share and tell, and I think that's going to be a big part of my podcast production is sharing stories, and I'm going to invite guests on and so they could tell their story about how I helped them and how confused they were. I mean, every day I sit down with somebody and my jaw hits the floor. I'm like, wow, this is mind-blowing. And education is everything. And you can't get your facts from Google. You can't get your facts from your friends. You can't get your facts even from your HR department in most cases. Quick side story, I had somebody say, I have to go on Medicare. I need to make an appointment to enroll in Medicare. And that's a service that I provide my clients. You don't have to be my client. I would help you enroll in Medicare A and B. It's a little confusing. I do it 10 times a day, so it's kind of a 10-minute thing. You could come to my office. I could come to your home, and I could help you. So she called me. She remembered me saying that at one of my seminars. And she said, I spoke with my HR department, and I have to get on Medicare. Maybe B. I'm not sure. I have to find out, she said. But HR said I have to get on Medicare. I'm turning 65. And I said, okay, why? And she said, I don't know. That's what HR told me. I said, okay, let's conference in your HR department. And the woman from HR said, oh, no, she's turning 65. She has to go on Medicare. And I said, why? She's still working full-time. She has group coverage. Why? does she have to go on Medicare? Is that something that you negotiated with your plan? And she said, no. I said, are you less than 19, over 19? She said, yeah, we have more than 19 employees. And I said, okay, then the law states that she does not have to go on Medicare, A or B. She could stay on her group coverage and continue to work. But the moment that she leaves her job or drops her group coverage, she has to go on Medicare. So the woman said, that's interesting. So I went to Medicare.gov, I found the law, I forwarded it to her. Could she have gone on Medicare? Yeah. Would it have been beneficial to her? No, it wouldn't have. Because what happens is when you go on Medicare, A or B or just A, your first year that you're on Medicare, you have a year to play around. You could try a Medicare supplement plan. You could try a Medicare Advantage plan. You could try a Medicare Advantage plan. If you don't like it, you could switch to another Medicare Advantage plan. That's your first year in Medicare. But if you go on Part A and you don't use your other coverage, that window closes. So if you were on Medicare Part A and you had group coverage, you lost that window to be exploratory with Medicare. So it's not in your best interest to go on Medicare. But a lot of people don't know these things. And if you Google, do I have to go on Medicare at 65? You're going to see 100 different things. So sit down with somebody like myself or another trusted Medicare advisor and figure out a plan for you before you turn 65. Figure out what you have to do. And things change. My name's James Donnelly. My agency is Safehaven Insurance. We're in Melville, New York. I'm licensed across the country. I'm licensed currently right now in 36 states. And the reason I'm licensed in 36 states is because as people call me and say, hey, my mother lives in Georgia or my sister's moving to Tennessee, I get licenses in those states just so I could work with them. So feel free to call me across the country, and I would love to sit down with you and just see if you're in the right place. Or you could call me and I could refer a Medicare agent that's local if you want to sit down with somebody. I do that all the time because people like face-to-face interactions. But there are options out there. There's a lot of options out there. And don't answer your phone for strangers from call centers. Don't throw out all that crap that you get in the mail. So this is our first podcast. And I wanted everybody to know why I do what I do and why I love what I do. I love helping people. I love educating people. So we're going to be doing this podcast every week. We don't have to do it here in the studio. We could go to your location if you're interested in being a sponsor of this podcast or us debuting your business. We'd love to come to your restaurant or your place of business and do a little debut of your business and shoot there. We look for different pieces of scenery. And if you want to be on the podcast, if you want to ask us questions, you can email me at james@safehavenagency.com, or you could call me 631-608-1137 with any questions that you have, or if you want to be on the show, we'd love to have you. And that's it. Looking forward to seeing you next week. Thank you, everybody. Have a great day.